antifungal medication like terbinafine or fluconazole. And the rash on the right is really emblematic of the atopic syndrome. So we treat that as we would treat any eczema. So fungal infections or tick infections are really caused by 3 organisms, and many of us like to use the Woods lamp to diagnose that, but remember, only one species of the Woods lamp is fluorescens, and that's the Mycosporum. So we can't use that as the definitive option. But usually most derm rashes clear pretty quickly with the right treatment plan. So if after a week or 10 days we're not doing better, then we need to go back and sort of rethink our diagnosis. So typically on non-hair-bearing areas, we can treat that topically. And on hair-bearing areas, because the epidermis goes so far down into the follicle, we treat that orally. Now, sometimes we see things on the rashes of the hands and feet. And back in the States, many people believe that rashes on the feet have to be athlete's foot or some sort of fungus. But on the palms and soles, we don't tend to see fungi very often. So we see rashes on the palms and soles often in the spectrum of atopic dermatitis as well as psoriasis. So again, when we see fungal rashes, the scale tends to be at the periphery, not centrally. And the itch of atopic dermatitis, as you all know, tends to be intractable. The itch is horrendous. The itch is changing the quality of life. And so we treat these as we would treat any atopic dermatitis with topical steroids and calcineurin inhibitors and IL-4 and IL-13 blocking agents. And now we have JAK inhibitors, which are part of that. But remember, scaling rashes require insight and thought and the appropriate diagnostic techniques. And remember that dermatology is a disease of patterns and geography and body areas. So when we see a rash on the abdomen, we look at other areas. And here we see, I'm going to try this again. That was bad. The circle I have there is our scraping site. And the umbilicus, the belly button, is a very, very common space for scabies, sarcoptes. And keeping in mind the atopic patient is more prone to develop sarcoptes, fungus, virus like mollusca, and bacteria like impetigo. So if we have someone who develops sarcoptes, it's important for the entire family, the entire cohort be treated with medicines like elamite and permethrin, and we use those both, not either or. But again, when we look at patterns, we like to think of things that remind us of certain things. And this truncal rash, we might think of as tinea versicolor or pityriasis versicolor, but if you look at that pattern, it's not so confluent and the patient's a bit older. So again, the circle is our biopsy site, and this patient has the exact same problem, that atypical patchy hypopigmentation, which is cutaneous T-cell lymphoma, which we call mycosis fungoides. And that can be quite serious. It starts as a small eczematous phase, then can be a patch stage or a plaque stage, and can become quite serious. And that, fortunately, it's a very slow-growing tumor, slow-growing malignant event. So that is why the 3-punch biopsy is something that I insist on all of our medical students, all of our residents, and physicians across specialties have a mastery of. Because a 3-punch can confirm your suspicions, and it sometimes, if your suspicions are just too wide, can help you narrow the focus. So many times people will think of acne as just a adolescent hormonal situation, which is not a big deal. Although I think we're all aware of the stigma, the frustration, the shame associated with facial acne and even truncal acne. So fortunately, when we have such advances in acne management, we have isotretinoin, which is a disease-altering, life-changing disease. But you can see this person's cystic acne is horrendous. Horrendous. You can imagine trying to go to school, the swimming pool with this. But this patient now, same patient, is post-Accutane and post his first CO2 laser. So we do some laser. This is his first CO2 laser post-acne. And his self-esteem, his self-image, his quality of life is improved because he is no longer embarrassed about going to the pool or going to the gym or participating in sports without wearing his shirt. One thing I'd like us all to keep in mind, that ulcers on the skin, particularly of the legs, are not a diagnosis, but they are a symptom. If you have a hole in your leg, we had to figure out why.